Today is National Celiac Awareness Day. It's a chronic condition affecting an estimated 2 million Americans. So, in today's checklist, we are talking about the symptoms, risk factors, and how to manage it so you feel better.
So, as some of you know, my son Calvin was diagnosed last year with celiac disease. And since then, I've supported the efforts of Beyond Celiac. It's a patient advocacy and research-driven nonprofit. And I recently took part in their new PSA to educate people. Take a look.
Here is an afternoon treat.
Ooh, yummy. Thank you.
You're welcome.
Are those cookies gluten-free?
For the 1% of Americans with celiac disease, eating gluten-free is not a choice. It's a medical necessity. To people with celiac disease, gluten acts like a toxin, triggering the body to attack itself. There are so many details and so much to learn. So here to help us is author of Gut Renovation, Dr. Roshini Raj. Good morning.
Good morning.
Good morning. So let's talk about, celiac disease itself, because so many people don't really understand it. They think it's a fad. They think it's like, oh, it's just go gluten-free. But what exactly is it? What are the risk factors?
Yes, so celiac disease is an autoimmune condition. When your body actually is exposed to gluten, you develop inflammation in your small intestine. And because of that, it's a very real condition. We can diagnose it with a biopsy. And there's certain people that are at higher risk, certainly if you have a family member. So a parent, a sibling, or a child, you're at increased risk for celiac disease. But also if you have other autoimmune conditions, things like diabetes type 1 or thyroid disease. And then there are certain ethnic groups. We used to say really Northern European ethnicity, but now we're really seeing it in all populations.
Right. So celiac disease is a condition where the body actually attacks itself, but there's also folks who have a gluten intolerance.
Yes.
Explain that.
So this is totally different in the sense that if we did a biopsy on someone with gluten intolerance, we would not see any abnormality. There is no inflammation going on. It's not an autoimmune condition. But when you have gluten in your diet, you tend to feel kind of lousy. And you may have some of the similar symptoms, things like bloating or diarrhea, abdominal pain. But it's not true celiac disease, which means you should generally avoid gluten to feel better, but you don't have to be super strict as someone who has celiac disease because you're not actually damaging your body by taking in gluten.
Okay. No, Dylan and I have talked about this. I have a feeling there are a lot of people like me who, I'll be honest with you, I think I feel better. She'll bring things on the show, even a hamburger, but it'll have gluten-free bread, and I won't feel that stuffed feeling or that bloated feeling. So can you go over the digestive systems and then the non-digestive symptoms, I should say, for what maybe somebody watching should expect?
Absolutely. And it can be confusing because there's some crossover between celiac and gluten intolerance in terms of symptoms. But in terms of digestive symptoms, so things like abdominal pain, bloating, weight loss, we consider digestive system, changes in your bowel movements. Those are things that you can see, constipation as well. But then you can also have the non-digestive symptoms, things like brain fog or anxiety, depression. There's certain rashes that are characteristic of celiac, or even joint pain, certain types of arthritis. Those are all things that could be a sign of celiac. And it's interesting, Chanel, that you said, you feel kind of lousy. Maybe you think you might have an issue.
How you just kind of suck it up every day? Well, you don't know, you probably because you don't. But a lot of us just kind of, you just get by.
Right.
You get used to it.
And what I think is really interesting or important to point out is if you think you may have celiac, it's very important to get tested before going gluten-free on your own. Because the test that we do, whether it's a blood test or the actual biopsy, that will actually become falsely normal if you've already gone on the gluten-free diet, even if you have celiac.
You need
so it's
gluten
very,
in your system.
you need gluten in your system for at least a couple months.
Wow.
So you want to see your doctor before on your own trying gluten-free.
We were fortunate that Mike Calvin was diagnosed when he was 6, but there's so many young adults and even adults in their 30s and 40s who get diagnosed.
Correct.
Are the symptoms the same for children and adults? And why does it take so long to get the diagnosis?
Yeah, so children tend to have even more of the digestive symptoms as opposed to the non-digestive, but even children can have things like short stature because when you're inflamed in your intestine, you're not absorbing the nutrients you need to grow and to gain weight. But you're right. I mean, many people go years and years without getting a diagnosis. They kind of feel a little bit off, but they don't do anything about it. I have patients who they've come in because they had a sibling who had celiac and they were tested. And when I asked them initially, how do you feel? They say, oh, I feel fine. They found out they have celiac. They get tested. They go on a gluten-free diet and they actually feel 1,000% better than they did before, even though they felt fine. So it's really an interesting disease, and it's something you want to get a diagnosis for.
Well, your personal PSA.
I know.
Get tested,
this was very
please.
informative. Thank you.
Dr. Raj, thank you so much.
Oh, thank you.
And to learn more about celiac disease and that Beyond Celiac PSA, just go to today.com.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.